Have you been feeling just flat lately? Not sick, not necessarily in pain, but just lacking that spark, that energy you used to have. Maybe you find yourself saying no to things you used to enjoy, or feeling completely drained by the afternoon, even after a decent night's sleep. It's a feeling many people experience as they get older. And it's easy to just shrug and think, well, this is just part of getting old, isn't it? But what if that feeling wasn't just inevitable aging? What if there were often very treatable, sometimes surprisingly simple reasons for it? The painful reality is that accepting this flatness can steal years of joy and activity from your life. You might miss out on time with grandchildren, hobbies you love, or just the simple pleasure of feeling vibrant. But here's the secret. Many of the underlying causes, even if they seem unrelated at first, fall into the area of health that a urologist understands deeply. In this video, we're going to look at some surprising connections between your urological health and how energetic and vital you feel. And we'll uncover practical, emergency advice from that perspective that can help you reclaim your energy. We'll explore simple daily habits and things to discuss with your doctor that can make a world of difference. Watch to the end for something that will surprise you and could be the key to feeling much, much better. Let's dive right into one of the biggest energy drains that often goes unrecognized. And it's something a urologist sees all the time: disrupted sleep, particularly from needing to get up multiple times during the night to use the bathroom. This is often called nocturia, and it's incredibly common as we age. You might think it's just an annoyance, a mild inconvenience, but the cumulative effect of broken sleep is profound. When you're constantly being pulled out of deep sleep cycles, your body and brain don't get the restorative rest they need. This doesn't just make you feel tired the next day. Over time, chronic poor sleep impacts everything: your mood, your ability to concentrate, your physical energy, even your immune system. From a urologist's perspective, there are several reasons this happens. For men, an enlarged prostate, benign prostatic hyperplasia, or BPH, is a frequent culprit. The enlarged prostate presses on the urethra, making it harder to empty the bladder fully, so the bladder feels full again quickly. It can also irritate the bladder, leading to stronger urges. For women, changes after menopause can affect bladder elasticity and capacity, leading to more frequent urges, day and night. Pelvic floor weakness can also contribute. Beyond specific anatomical changes, there are lifestyle factors that significantly impact nighttime urination. One of the most overlooked is when and how you drink fluids. Many people try to stay hydrated during the day, which is excellent, but then don't adjust their fluid intake in the evening. Having a large glass of water, tea, or any other drink right before bed is almost guaranteed to result in a trip or two to the bathroom a few hours later. The simple, actionable advice here is to front-load your hydration. Drink plenty of water throughout the morning and early afternoon. Aim to finish your main fluid intake a couple of hours before you plan to go to bed. If you're taking medication in the evening, take it with just a small sip of water, not a full glass. Of course, if you feel thirsty, you should always drink, but be mindful of large volumes right before sleep. Another aspect related to fluid intake is the type of fluids you consume. Certain drinks are known bladder irritants and can increase urgency and frequency, especially at night. These include caffeine in coffee, tea, soda, alcohol, and acidic juices like orange or cranberry juice. Enjoying a cup of coffee or a glass of wine earlier in the day might be fine for some, but having them in the late afternoon or evening can be a direct cause of nighttime bathroom trips. Experiment with cutting back on these in the hours before bed and see if it makes a difference. Switch to plain water or herbal teas non-caffeinated, of course in the evening. Now, while lifestyle adjustments are crucial and often very effective, it's vital to understand that persistent nocturia can be a symptom of an underlying medical condition that needs proper diagnosis and treatment. This is where the urologist comes in. Don't just accept it as normal aging. Mention it to your doctor. They can investigate potential causes like BPH, overactive bladder OAB, urinary tract infections, UTIs, or even other conditions like diabetes or heart issues that can affect fluid balance and bladder function. Simple treatments, lifestyle changes, or medications for these conditions can dramatically reduce how often you need to get up at night, leading to significantly better sleep and, consequently, much more energy during the day. Thinking about how much better you'd feel after even just 1 week of solid, unbroken sleep is incredibly motivating, isn't it? It highlights just how much this one issue, often seen as minor, can contribute to that overall feeling of flatness. Addressing nighttime urination is fundamental to reclaiming your energy, and it starts with paying attention to your fluid habits and talking to your doctor about persistent symptoms. It's often the first key step a urologist will help you with to boost your vitality. Moving beyond just getting a good night's sleep, let's talk about another area that's directly linked to how energetic you feel, and one where a urologist often has valuable insights, perhaps in a way you haven't considered before. This is the realm of hormonal balance, particularly in men. Though women's hormonal changes after menopause also significantly impact urological and overall health. For men, as we age, testosterone levels naturally decline. This is a gradual process, and the extent varies greatly from person to person. While low testosterone is often associated with changes in libido or erectile function, it also plays a crucial role in energy levels, muscle mass, mood, and bone density. When testosterone levels drop too low, men can experience significant fatigue, loss of interest in activities, difficulty concentrating, and a general lack of drive. In short, feeling flat. A urologist is often the specialist who evaluates and manages low testosterone because of its link to reproductive and urinary health. It's important to distinguish between the natural, gradual decline of testosterone and clinically low testosterone, often referred to as hypogonadism. If you're experiencing significant fatigue, muscle weakness, or mood changes, it's worth discussing with your doctor, who might refer you to a urologist or an endocrinologist. They can measure your hormone levels through a simple blood test. Now, I'm not advocating for testosterone replacement therapy for everyone. That's a complex decision to be made in consultation with a specialist, weighing the potential benefits and risks. However, simply being aware of this possibility is powerful. Many men suffer from fatigue and low mood in their 60s and beyond, attributing it solely to age, when a treatable hormonal imbalance could be a significant factor. Even without clinically low levels requiring treatment, there are lifestyle factors that can support healthier hormone balance naturally, which in turn supports better energy. Regular physical activity is one of the most effective. Exercise, particularly strength training, can help maintain muscle mass, which is influenced by hormones and has been shown to have a positive impact on mood and energy. You don't need to become a bodybuilder. Simple exercises using your own body weight or light dumbbells a few times a week can make a difference. Consistent, good quality sleep, which we talked about earlier, is also absolutely critical for hormone regulation, and a balanced diet rich in lean protein, healthy fats, and plenty of vegetables supports overall hormonal health. While diet alone can't treat clinical hypogonadism, it contributes to the body's ability to function optimally. The link between hormonal health and urological health isn't just about energy. Low testosterone can also impact urinary function in men and is often intertwined with prostate health discussions. Similarly, in women, hormonal shifts after menopause, specifically the decline in estrogen, impact the tissues of the bladder and urethra, potentially leading to urgency, frequency, and incontinence, all issues that disrupt sleep and energy. While a urologist might not directly prescribe hormone replacement therapy for women, that's usually the realm of a gynecologist or GP. They understand the impact of these changes on the urinary tract and can offer strategies, treatments, and lifestyle advice to manage symptoms. For instance, Topical estrogen therapy applied vaginally can be very effective in improving bladder and vaginal tissue health and reducing urinary symptoms in postmenopausal women, leading to better sleep and more energy. So, if you're feeling flat, especially if you're a man in your 60s or beyond, consider discussing your energy levels, mood, and muscle strength with your doctor. A simple blood test could reveal a hormonal component, regardless of your gender. Understand that the major hormonal shifts that occur as we age have a direct impact on urological function, which in turn affects your sleep and energy. Taking proactive steps like staying active, eating well, and prioritizing sleep supports not just hormonal health, but your entire system, including your bladder and prostate. It's about seeing your body as an interconnected system, where addressing issues in one area, like hormonal balance or urinary function, can have positive ripple effects on your overall vitality and lift that feeling of flatness. And always remember to discuss persistent fatigue or other concerning symptoms with your doctor. They can help identify the root cause. Beyond sleep and hormones, there are other seemingly unrelated areas that powerfully influence your energy levels and are often addressed, directly or indirectly, by a urologist's advice. One significant factor is your gut health, specifically how well your digestive system is functioning. While you might think the gut is separate from the urinary tract, they are physically close and share nerve pathways. Constipation, which is very common in older adults due to slower digestion. Diet, hydration issues, or medication side effects can put pressure on the bladder and pelvic nerves. This pressure can worsen urinary urgency and frequency, mimicking or exacerbating symptoms of an overactive bladder or BPH. And how does chronic constipation make you feel bloated, sluggish, and definitely low on energy? It's a classic cause of feeling flat. A urologist understands this connection. When someone comes in complaining of bladder issues, they will often ask about bowel habits. Simple advice to improve gut health can have a direct positive impact on bladder symptoms and overall energy. The cornerstone of addressing constipation is often increasing dietary fiber and staying well hydrated. Two pieces of advice that come up repeatedly for overall health, including urological health: eating a diet rich in fruits, vegetables, whole grains, and legumes provides the bulk needed for healthy bowel movements. Prunes, figs, and flax seeds are particularly helpful for many people. Combined with adequate fluid intake, remembering our earlier point about when to drink, this helps keep things moving smoothly. Regular physical activity also stimulates bowel function, adding another layer of benefit. Sometimes, simple over-the-counter remedies like fiber supplements or gentle laxatives might be needed, but dietary changes are usually the first line of attack. By improving your gut health, you can potentially alleviate pressure on your bladder, reduce bothersome urinary symptoms, get better sleep, and eliminate the draining feeling that comes with being constipated. It's a vital, often overlooked, piece of the puzzle when you're feeling low on energy. Another area that impacts energy and connects to urological health is stress. Chronic stress doesn't just affect your mental state, it has profound physical effects. Stress can lead to muscle tension throughout the body, including the pelvic floor muscles. Tight pelvic floor muscles can contribute to urinary symptoms like urgency, incomplete emptying, or even pain. Constantly feeling on edge due to stress is also incredibly draining on your physical and mental reserves, leading directly to that feeling of being flat. While a urologist isn't a stress therapist, they recognize the impact of stress on the body and may advise patients on stress-reducing techniques, especially if stress seems to be exacerbating their urological symptoms. Simple practices like deep breathing exercises, mindfulness meditation, gentle yoga, or even just taking a few minutes each day to relax and disconnect can help release physical tension, calm the nervous system, and improve both bladder function and energy levels. Finding hobbies or activities you enjoy that help you unwind is also crucial. It's about consciously building moments of calm into your day to counteract the effects of stress. Finally, let's touch upon the elephant in the room for many men: erectile dysfunction (ED). While not directly causing physical fatigue in the same way poor sleep or hormonal imbalance does, ED can have a significant impact on a man's mood, confidence, and overall sense of vitality. The emotional toll of ED can be immense, leading to anxiety, depression, and withdrawal from intimacy, all of which contribute to feeling flat or low. ED is often a vascular issue, poor blood flow, and can be an early warning sign of more systemic health problems like heart disease or diabetes. A urologist is the expert in diagnosing and treating ED, but the conversation often goes beyond just prescribing medication. They will discuss lifestyle factors that impact blood flow, diet, exercise, smoking cessation, managing blood pressure and cholesterol. Addressing these underlying health issues not only treats the ED, but also improves overall cardiovascular health and energy levels. So, while ED itself isn't a cause of physical fatigue, the conditions that cause it, and its emotional impact, are significant contributors to feeling low on energy and vitality. Discussing ED with a urologist isn't just about sexual function. It's an important step in assessing your overall health and taking action that can improve how energetic and positive you feel about life. So, as we bring this all together, you can see that feeling flat in your 60s and beyond isn't always just an inevitable consequence of getting older. Often, it's a signal from your body that something needs attention. From the perspective of a urologist, many seemingly unrelated issues, disrupted sleep due to nighttime bathroom trips, hormonal changes, gut health problems like constipation, stress, and even issues like erectile dysfunction, are interconnected and can severely impact your energy levels and overall vitality. The emergency advice, the crucial steps to take, aren't necessarily complicated procedures, but rather a return to fundamental self-care, informed by understanding these connections. Remembering the importance of timing your fluids to minimize nighttime wake-ups can be revolutionary for your sleep quality. Paying attention to bladder irritants like caffeine and alcohol, especially in the evening, is another simple, powerful adjustment. Considering if hormonal changes might be playing a role, especially for men experiencing significant fatigue. And talking to your doctor about getting levels checked can open doors to effective management. Addressing gut health, ensuring you're getting enough fiber and hydration to prevent constipation, can relieve pressure on your bladder and lift that heavy, sluggish feeling. Finding ways to manage stress through relaxation techniques or enjoyable activities calms the nervous system and reduces tension that drains energy. And for men, viewing a conversation about erectile dysfunction with a urologist as an opportunity to improve overall vascular health and emotional well-being is key to regaining confidence and vitality. None of these steps require a complete overhaul of your life overnight. They are small, actionable changes you can start implementing today by addressing these areas, many of which fall under the umbrella of things your urologist considers in relation to your urinary and reproductive health. You can make significant strides in combating that feeling of being flat. Don't dismiss these symptoms as just part of getting old. Be proactive. Talk to your doctor, specifically mentioning how low energy is impacting your life. Describe any changes in sleep patterns, urinary habits, bowel function, or overall mood and physical ability. A simple conversation could lead to identifying an underlying, treatable issue that is holding you back. You deserve to feel energetic, engaged, and capable at every age. Reclaiming your vitality starts with listening to your body and understanding that many factors contribute to how you feel. Taking these steps, improving sleep hygiene, being mindful of hydration and diet, considering hormonal health, supporting gut function, managing stress, and addressing sexual health concerns, are not just about preventing disease. They are about actively choosing to live a life filled with energy and purpose. We've covered quite a bit, exploring the often hidden links between urological health and that draining feeling of being flat. What resonates most with you from what we've discussed? Have you tried any of these strategies before? Or are there other things that have helped you maintain your energy as you've gotten older? Please share your thoughts and experiences in the comments below. Your insights could be incredibly helpful to others watching. If you found this video helpful and informative, please give it a thumbs up. It helps the channel reach more people who could benefit from this information. And, if you haven't already, consider subscribing to my channel for more practical health advice aimed at helping you live your best life, no matter your age. Thank you for watching. Keep taking care of yourself. Listen to your body, and work with your doctor to address any concerns. You have the power to feel better and live your best life at every age.